I'm going to go ahead and get started here, in which we will talk a bit about cannabis and frame it around what do we know? And of course, I'm going to do this as far as health considerations and things that we can think of that maybe cannabis may be very helpful for, but with the idea that we also need to understand that like everything, there can be some unwanted effects. And so it's important for us to be able to consider what are the good and what is the harm of things like cannabis. And so with that, I want to just start with the idea that AZ-CAN is a cannabis education program that's being delivered by our University of Arizona's Comprehensive Pain and Addiction Center, of which I am the director of. This educational program is supported by a grant from the Arizona Department of Health Services, and that the content that I will be delivering here today are solely the responsibility of the authors of this content and do not necessarily represent the official views of the Arizona Department of Health Services. I want to also point out Galen Dara, who has helped with the illustrations, is also in this presentation as a collaboration with members of our Comprehensive Pain and Addiction Center, as well as the Arizona Poison and Drug Information Center. I also want to acknowledge that the University of Arizona is on the land and territories of the indigenous people. Today, Arizona is home of 22 federally recognized tribes, with Tucson being home of the Ohodum and the Yaqui. It's committed to diversity and inclusion. The university strives to build sustainable relationships with sovereign Native nations and indigenous communities through education offerings, partnerships, and community service. All right, well, let's talk first a little bit about the current use of cannabis today, as well as the prediction in the future. And we know that there's increased use with the fact that many states are making it more and more legal. And I believe there may be initiatives in the future so that it becomes federally legal. So let's talk about what's the number of people that are using cannabis. The best that we can predict, and again, this is based off polls, is that 48.2 million Americans use cannabis today, which is about 18% of the population. And again, it's based off of polls, so we don't know necessarily how many people are truly being honest in a particular poll, but it's a good number, right? 48.2 million, 18% of the population. Now, if we compare this to other substances being used like tobacco or alcohol, we know that alcohol has about 140 million users, so not close yet to alcohol, but tobacco has 46 million. So really, cannabis is being now used more often than tobacco. Cannabis use has increased this past year by 43%. This is a leader in substance use as far as percent growth as compared to other things. And so there's no doubt that there was more use of cannabis the past year, or the increased percentage of cannabis use as compared to other substances. And the prediction, if this percent increase continues, is that the number of Americans that will use cannabis by 2030 will be 71 million. And some people predict closer to 100 million, which is either 1 out of every 4 or 1 out of every 3 Americans will be using cannabis. The sales, another way to sort of predict the use of cannabis. And so if you'll look at the sales today, it's at this here, the legal recreation and medicinal cannabis is at anywhere from 17 to $20 billion. You can see that it's more than the National Football League, which is expected to be about $12 billion. If you look at craft beer in the US, it's at 27 billion, so it's a little bit higher. If you look at the global opiate, now this is not just the US, although the US is one of the biggest users of opiates, that's at 26 billion. But what you should see here is that if that percent increase continues and more people continue to use cannabis, that by 2026, which really isn't too far off, it's expected to be at $52 billion. And so it is a market that is increasing. As I said, more and more people are using cannabis, and so it's important that we be aware of some of the effects, both medicinally, but also the unwanted side effects. What are some of the major fronts in cannabinoid research? Well, when we look at cannabis, the plant itself, it's important for you all to understand that there are over 500 different chemicals that are in the cannabis plant. The predictions are about 537 constituents. I usually just say at least 500 different components. And many of these components we don't know anything about. And so I want to point that out first, that we're using something like medical marijuana or cannabis as a recreational product with a lot of chemicals in it, but we don't know much about. The one thing that has been heavily studied, and again, this is just one of those 500 compounds, is THC, referred to as tetrahydrocannabinol. A lot of the things that we think of, that we know about medical marijuana or cannabis, all comes down to knowing something about this molecule. And I just want to emphasize that we don't know much about all the other 499 plus chemicals in there. Most of the studies you read about and most of the predictions of what's happening is all based off us studying THC. Why? Well, number one, it was found years and years and years ago to be one of the most active components of the plant. It is the thing that produces the psychotropic effects. And of course, it's the one thing that people have been able to study, both research as far as what's happening as far as on a preclinical level, as well as even in clinical studies. So 60%, if not more, of research has to do with cannabis and marijuana as this particular type of molecule. And really, it's even higher than that when you start looking and digging into the research. What I want people to realize is that cannabis and the percent of THC has really, really changed in the plants from years and years ago. So years and years ago, the amount of THC was somewhere around 4%. Maybe you could find 5 or 6%. And again, there's different variants of that particular plant that you may find more and more. But in general, the percentage of THC is quite low. If we look back to 1995, it's about 15% in 2018, and even getting higher, 17 to 20%, and even some higher than 20% in today's plants. I point that out because more is not necessarily always better. And you're going to see as I go through this presentation that more or higher percentages may be leading to more and more unwanted side effects. And so more is not always better. I think most of us know that something at the right dose can produce the right effect, but more can produce unwanted effects and produce some other damages. I just want to point out the fact that there are all other types of cannabinoids. I think people have heard about cannabidiol, but there are also CBN compounds, which is a little bit different between these two. So here's a CBD compound in which, again, you can notice that the chemical structures are very similar, but a little bit different, and they produce some very different effects within the body. Terpenes are what give medical marijuana or marijuana in general the smell. Terpene is known as a chemical structure that actually, the name is derived from turpentine. Anybody that has smelled that, it has a strong smell. And it's a family of chemical structures that produce a particular type of smell. And it too may also have medicinal properties. So let's move here, in which I wanted to present something that might be new to the group, and that is looking at endogenous cannabinoid systems. The idea that our body has cannabinoid receptors is not just there waiting for some day that somebody might take some marijuana or some cannabis. Our body actually makes cannabinoid receptors for a particular reason, and we don't know much about it. But the point is that if it makes the receptor for these products, that means that your body must also make cannabis. Now, that always sounds weird, but we know for a fact that the human body has these receptors and that it actually does make its own cannabis. And I'll show you a slide here coming up. What does the endogenous cannabis do? And can adding more be good? Something that I'll discuss. Does cannabis have any medicinal properties? Yes, I think most of us would say yes, but we, again, have to limit the amount of things like THC that might be in that cannabis if we want to sort of reduce maybe some of the unwanted side effects. And can cannabis produce harmful effects? Yes. And again, I think it's important for us to understand that all things that are used medicinally, as anyone that would see a a modern commercial about any pharmaceutical drug knows that there may be something that may help with some kind of medical issue, but that they can also produce a number of unwanted side effects. Okay, when we look at the cannabinoids and the cannabinoid family, we know for a fact that there are two major cannabinoid receptors, in which, again, these are the receptors that are found on different cells in the human body that are exposed to the products that come from cannabis. So things like THC, as well as possibly things like the other types of cannabinoids. But then again, there are many other chemicals in that plant that we know may be acting at other receptors. And so I pointed out CBD may be acting at other types of G protein coupled receptors. There's idea that some of them may act at some of the channels that our body has, and even other types of proteins that are intracellular. So what's known about it? Not much. We know a bit about this receptor, CB1. It is the one in which THC will act to produce the psychotropic effects, but also some of the medicinal effects. As we know, it may be used for things like pain or nausea. And so we know for a fact that THC acts at this receptor, but there's also a CB2 receptor. This tends to be more limited in the human body on immune cells, whereas the CN does not produce psychotropic effects when activated, and may still also have very good medicinal properties. And likewise, some of the other effects at other receptors. When we look at the cannabinoid receptors, they are G protein coupled receptors, in which, again, when the THC or other types of cannabinoid products bind to the receptor, they activate proteins on the intracellular side, and it's showing you in the picture that we can get a number of different effects that can be long-lasting. We think of it as an amplification mechanism in which kinases are activated that can alter functions within cells. It can also alter functions of channels, so altering the excitability of things like neurons. And it can also affect things like calcium channels. And so we know that the functions of the receptors can activate and alter synaptic plasticity. Now, I say that with a bit of caution in the fact that there are a number of studies that have now come out recently to say that cannabinoids or cannabis can affect the cognitive functions and learning and memory. And again, it is shown that activation of CB1 receptors with high levels of THC can actually alter synaptic plasticity. What does this mean? This means the connectivity of the neurons within the human brain. And there's good evidence that high levels of things like THC can actually alter that activity. Now, is that good or bad? I believe we don't know the outcomes of that, but I will say that it's bad in a developing brain, because this is where you see a large amount of synaptic plasticity occurring in children and neonates. And it's very important that that process not be altered for mental development, and that a large amount of THC or chronic exposure can slow down this growth. Think of synaptic plasticity as sort of the growth of the brain and the connections that it's needing to make during a very important time in which there's a lot of plasticity occurring within the human brain. And so that alteration can occur, and most people should know that there is an effect. Now, I say that's THC, and most of the studies, again, are just on the one component. We don't know what those other 499 compounds might be doing as well. There's very few studies on those other compounds and synaptic plasticity, but we know that the THC is acting through the CB1 receptor to produce some of that effect. The CB2 receptor, when activated, can produce sort of a slowing down of the immune system, which actually may be very beneficial in people who have autoimmune disorders or rheumatoid arthritis or things with lots of inflammation, but it might not be good again in children and neonates in which they're just developing that immune system so that they can build immunity against things that are of foreign agents or antigens. So again, it's understanding the fact of many of these compounds, especially at higher levels, may be harmful at a younger age. But again, we'll go through a little bit of the medicinal things that may be helpful in adults. It's important to understand that the cannabinoid receptors are all over the body. This is a picture just to suggest the fact that they're not just in the brain, but they are in all organs of the body. Everywhere we look, we tend to find cannabinoid receptors. CB1, again, being more prevalent, it's on the neurons in the brain. CB2 is found in the brain, but more on the glial cells, the immune cells, like we call the microglia of the brain. And the CB2 receptors are found on local immune cells within tissue. So many of the organs of your body will have sort of its own resident type immune cells, and that's where we tend to find the CB2 receptors, whereas CB1 receptors tend to be on many, many parts of the body. And unfortunately, we don't know what a lot of the activity at those receptors are doing in things like the muscle or the bone, right, or the GI tract. So there's still a lot unknown, but we do know that when you're taking something like a marijuana product or cannabis product, that you're activating and engaging those receptors in different parts of the body. CB1 receptors, again, are thought to be heavily loaded in the CNS, and they are on many other different types of cells throughout the body. Again, it's the one receptor that's probably studied the most. It's where THC acts. And of course, we know that some of the things are federally approved. So we know that THC products are approved for things like chemotherapy-induced nausea, also to improve appetite in HIV and AIDS patients. Other countries have approved some of the THC formulations for pain, and often can be prescribed for something like that. And so these are some of the more approved components of things that are of THC nature, meaning that they act at CB1 receptors. But the downfall, at least in many patients, will complain about the psychotropic effects. Remember, many patients want to take it for maybe the chemotherapy, but they don't really want that psychotropic effect where they kind of feel like they're out of it. Whereas other people will consume things like cannabis for specifically that psychotropic effect. CB2 receptors, again, not as abundant as the CB1 throughout the body, a little bit in the central nervous system, meaning that they tend to be more on the glial cells. There are some suggestions that maybe they're also on neurons, usually maybe after some type of change, some pathological condition in which they can be upregulated there. But most often they're found on the immune cells. What's interesting is that right now there are no CB2 selective agonists on the market. Their potential is coming along, and the fact that they may be very helpful for pain and inflammation, being on immune cells, osteoporosis, as well as a few other things that are being discovered as far as autoimmune types of disorders. What's interesting is that activation of the CB2 receptors does not produce the psychotropic effects. Well, that makes sense. If they're really not on the neurons, they're not going to make the psychotropic effects. And so it's important to remember that these compounds don't produce the psychotropic effects, whereas selective THC, CB1 receptor compounds do produce the psychotropic effects. Okay, let's a little bit more about the body's own cannabinoids now. We do know that the body does make its own cannabis or endogenous cannabinoids. We call this the ECB system or endocannabinoid system. And does it have any type of medicinal therapies, which we are actively looking at ourselves, as well as many different companies now looking at whether they can enhance the endogenous cannabinoids within the person's body to help medicinally. But we also must keep in mind that if we increase it, we may also be causing some types of side effects. Let's look at the production of the endogenous cannabinoid. So if we look at any cell within the body, and almost every cell in the human body can produce this. I'm not going to say all, but a lot of the ones that we've looked at so far can produce this. So if we're just looking at a particular cell, whether it's in the liver, the lung, or the brain, here's the lipid membrane, here's a cannabinoid receptor, but let's look at the production of the endogenous cannabinoids. And one of the most abundant one is this guy right here that I've circled, the 2-AG or 2-arachidonoglycerol. A minor one is also AEA, so you can see I put a note here that the 2-AG is 200 times more abundant, so this is really the bigger product of the endocannabinoids, but there are other ones. The anandamide or AEA is another product. How are they made? Well, they're made directly from lipid membranes, and that's why they're found in so many cells throughout the body, is that these enzymes, this is just a lipase, different types of lipases that will produce this 2-AG using a lipid directly from the membrane. How interesting, huh? It makes 2-AG, and then 2-AG can act at the cannabinoid receptors, the same for AEA. And it acts at these receptors, and it can act at both CB1 and CB2 receptors to produce some different types of activations of those G proteins I mentioned. It's also a compound that rapidly gets broken down by the body because we know that when we make things within our cells, they also get degraded. And so there are enzymes that actually will degrade this 2-AG I've put here this lipase, this MAG lipase, or ABHD6. These are enzymes that will break it down and make eventually arachidonic acid that gets converted by a cyclooxygenase to become a prostaglandin. So isn't that interesting? We have something that may actually reduce pain and inflammation, but when it's broken down, it can produce prostaglandins, which we know will produce inflammation. So it's very interesting, this pathway. And so companies have taken an advantage, or at least the idea that they can try to inhibit these enzymes. And so there are new compounds coming on, things that we've used in our own experiments within the labs, but companies are producing compounds that block these enzymes. And they're using them for things, in my case, I'm using them for studying pain and inflammation, but other companies have been looking at cases of epilepsy and traumatic brain injury, Fragile X, excitatory events that occur in the brain that could even include things like seizures, as well as multiple sclerosis. By blocking this, we can increase the amount of 2-AG and decrease the amount of prostaglandins. And so this is one avenue that is being explored in which we can try to increase somebody's own endogenous cannabinoids. Now, I want to make the note that when we do increase endogenous cannabinoids, thus far, we don't see a lot of the psychotropic effects, which actually would be beneficial in the fact that we would be able to activate some of the cannabinoid system without producing some of the psychotropic effects. So I find it very interesting that they don't do this and may actually be a better way in order to activate these receptors for medicinal purposes. This is a study to show that the activations of things like CB2 receptors may be very neuroprotective. So this is looking at oxidative stress-related degenerative diseases, so things like dementia, in which they show that the endocannabinoid system that I just told you about that may act at things like CB2 receptors may actually reduce a lot of that inflammation that's occurring and activation of the glial cells and cytokines and reactive oxygen species. And so it may decrease some of the inflammation within the vasculature. And so it's thought that maybe increasing the system may be really helpful because it's reducing things that are producing reactive oxygen and nitrogen species that create damage to the cells and that are part of neurodegenerative diseases. And that targeting the system may actually have great consequences in helping things like stroke and TBI and dementia and Parkinson's and multiple sclerosis. So it's just sort of suggests the fact that investigating the endocannabinoid system and activation of CB2 receptors may be very beneficial. But I also want to state the fact that there are studies like this. This is a paper that came out in one of the high-profile journals of Cell, in which it was looking at the fact that since more people are using medical marijuana and THC, the percentage is increasing in these products. This particular paper looked at how THC could cause issues within the vasculature. And so it's a really important study to be aware of that as you increase the concentrations of THC, it may be starting to produce inflammation. Now, again, this is the yin and the yang, the opposite. So CB2 can decrease, but CB1 activation at high levels may produce inflammation, and it's causing it in the blood vessels. So here you can see that THC may be producing increased atherosclerosis, which could lead to heart attacks as well as strokes. And the study was a beautiful study to suggest how it's doing that if they blocked THC, they could block the effect. They also showed that using combinations of other cannabinoids, there's that CBD again, or CBG, terpenes, they could all reduce the side effects that were being induced by the THC. So again, I want to point out the idea that increasing THC may not have a medicinal advantage, and that unfortunately, a lot of the plants that are being produced now and grown are increasing that percentage. I showed you it's gone from 4% all the way up to close to 20%. And I think that may be doing more harm than good, and the fact that higher levels can produce a number of different unwanted side effects. And we should be really thinking about the combinations of THC, because of course, if you buy a gummy, it's all THC, but maybe the combination of THC with some of these other things, CBD, CBG, terpenes, may actually help reduce some of the unwanted effects and gain the more medicinal effects. This is a publication that came out from the National Institutes of Health and the National Institute for Drug Abuse. The director, Nora Volkow, is the first author on this paper and really was pushed to put out something about the short-term and long-term effects of the use of medical marijuana, especially with the increasing of THC percentages in these plants. So short-term effects, we should be thinking that there is impaired short memory, impaired motor coordination, altered judgment, increasing risk of such behaviors, and high doses in paranoia and psychosis. So again, some of this looks very similar to something like the use of alcohol, right? There may be a little bit more of the paranoia and psychosis with THC as compared to alcohol, but the point is that we should be aware of that and understand that we have rules even with drinking of alcohol and things like driving as far as coordination and risk taking. But we should also be aware that THC may produce some increases in psychosis, especially in those that are prone to this. Now, again, sometimes we don't know who's prone to psychosis episodes or paranoia. But what it's been shown is that the high levels of THC may actually bring this out in an individual, but not all people. Long-term use, heavy use. Now, this is where you really should pay attention to the fact that there are a number of different issues that come out when there's heavy use of THC and or medical marijuana as proposed in the study. Of course, there can be cases of addiction in which, of course, using any substance over and becoming more in need of that compound leads to addiction. And whether it's with THC or other components can be quite dangerous. Altered brain development. As I mentioned, again, brains are developing all the way up into the ages of 20 to even a little bit older, especially in males, where they develop a little bit slower than females. We have to understand that there can be some altered brain development, and how that turns out is still being studied. But there's no doubt that we know that THC will alter that synaptic plasticity. Remember that connection of the neurons that I mentioned. Poor educational outcome, increased likelihood of dropping out of school is correlated with heavy use of THC. Cognitive impairment, again, this is this idea that we just aren't going to function very well if we continue to have high levels of THC on board. Diminished life satisfaction and achievement. Symptoms of chronic bronchitis, of course, because a lot of this is being inhaled through vapor or smoking. Increased risk of chronic psychosis disorders, including schizophrenia in persons that are predisposed in such disorders. Again, there's no doubt that in some cases this has occurred. I want to suggest the fact that the THC, and especially at high concentrations, may be sort of guilty for producing some of this effect, and that, again, more may not be better. I also want to point out the idea of being responsible with the use of cannabis. It's important that we understand that children may get their hands on. This was an excellent study that was published here this year in 2023, in which it looked at pediatric edible cannabis exposures and acute toxicity. Now, most of this was through gummies, and of course, gummies are attractive to children as well as probably to adults. And what you see right away is the number of children showing up in the emergency department that have had exposures and high-level exposures to things like THC, basically through gummies. And you can see when you look at this chart here from 2017 to 2021, a huge increase. Now, again, more states are legalizing the use of cannabis and THC products, but unfortunately, children are getting their hands on this. So there was over 7,000 exposures from 2017 to 2021, over 1,000% increase in children showing up in emergency departments due to exposure to cannabis. And basically, a lot of it was THC products that were in gummies. So the take-home message is that it's important for providers to be very aware of this in practice, and that it presents really an important opportunity for education prevention. Again, I don't think selling it as a gummy is the wisest thing, but if it's going to be done, it should be done in safety-proof bottles. It should be told to adults that kids can get very sick. It can cause severe seizures, is what some of the reports showed. If you look at the details in this particular paper, they're showing up in the emergency departments. And so we need to be more responsible with how we store that and who gets their hands on these products. This is just to show again that we know that some activation of CB1 receptors by THC at high levels can produce that inflammation, as I mentioned, that vascular inflammation of that cell paper, but it produces inflammation of the cells throughout the body as well as in neurons and glial cells, and that the chronic exposure does increase inflammatory markers in our body. Now, those have been measured in humans, and it can increase things like stress and anxiety. Okay, and so they definitely have increased with cannabis users, as published in the JAMA Psychiatry paper, suggesting that higher levels and chronic use can produce these types of things. And I don't think any of us really need more stress or anxiety in our lives. An excellent study to sort of suggest that THC may, at high levels, produce some loss of what we call baseline of functions of the human brain. Now, this is a study that was done in humans. These are adult humans looking at sort of what they call the resting state functional connectivity of the brain itself. And what it showed in this study using imaging is that the THC really disrupted what they call the default mode network. I think of that as sort of the baseline functions of the brain. Okay, and it includes particular areas of the brain, but it was the THC. And again, this was a study that was done with high levels of things like THC, but it showed that it actually changed adult brain baseline functioning. Other products within the plant did not, so it said that CBD did not produce this effect. And a matter of fact, when they combined the CBD with the THC, it actually restored the disruption. Again, this goes back to the suggestion that the combination of something like a THC with the CBD might actually reduce some of the unwanted side effects. They also showed that lower levels of THC did not produce it. So it's really that high level and chronic use that's really producing those effects. The endocannabinoid system, I had mentioned that, and I just wanted to show the idea that it may be very helpful in other things like obsessive compulsive disorder. Again, another wonderful study that was done in humans, in which they showed that it may be effective by enhancing its activity, the endocannabinoid system. We can actually help with obsessive compulsive disorder. This is a disorder in which there's lots of thoughts that occur within the human brain. It goes through the areas of what they call the basal ganglia, but those thoughts result in motor movements. So anybody that knows a patient who has OCD, it'd be a patient who thinks that, let's say, things are always dirty, like there's lots of germs. And so the thought results in the patient then going to wash their hands. And that's the motor component that, again, runs through the basal ganglia. That washing of the hands then gives somewhat of a reward, which is what we think of as this particular circuit that says, okay, you washed your hands, you get rid of the bacteria. Of course, unfortunately, they go back to this, and then before you know it, they're thinking about bugs again, and then they're back to washing hands. It is, unfortunately, a circuit that's hard to break, but this particular study showed that the endocannabinoid system and some of the cannabinoid receptors are heavy in all of these areas of the brain, as well as the basal ganglia, and that they actually showed that they could reduce this. Now, the neuroimaging studies have showed it in humans as well as in animal models, have showed that the endocannabinoid system, when activated, could actually reduce some of the anxiety and the compulsive repetitive behaviors. And so here you're seeing the fact that I just told you a little bit about high THC levels in CB1 producing stress and anxiety. But if we can figure out ways to activate our own systems, it actually may reduce some of this stress and activity. Again, it's just suggesting the fact that there's a lot of unknown, and we need to do more research to sort of figure out what is the good and what is the harm when activating sort of the cannabinoid receptors, endocannabinoid system. I just want to point out the fact that many things are mislabeled that are online. In this case, it's talking about cannabidiol, but you will see this also with medical marijuana. Fortunately, many of the growers that are official growers within our state of Arizona do label properly. And so I'm very happy about that. And I know that it's one of their goals is to continually make sure that their clients, which are people coming in to buy products, know exactly what are in the products. And I think that's important. Many of them will tell you the percentage of THC. I just want to point out again that higher levels don't necessarily mean it's better. We all think that more is better, unfortunately, but it's not the truth, especially in the cases of THC. But I just wanted to point out the fact that this was a study in which they took some of the products, sent the products to many of the universities, and many of the products did not match the label. Now, these are products that are coming from street markets, corners of the streets, not places that are really trying to do the job of letting them know exactly. So I would say these are not some of the different growers and legal sellers throughout the state. These are more of the picking up the stuff on the corner. But it just suggests the fact that many of the products don't match their labels, and that often when they say there's no THC in there, that's mislabeled because many of the products, 21% of the sample still had some THC in there. So it's just a slide to say beware of where you get your materials from, and that things are not necessarily always correct. And there's nothing wrong with wherever you do seem to pick up your products is to ask what might be in there and how do they know. Again, a little bit more about product reliability. Some of the CBD vapes on the street contain other things, and I'm just using CBD because it seems like a lot of the studies were focused on this for some while, but I would also put in there things like medical marijuana that's being found at areas off the street. There's all kinds of things that are showing up in here. James Neil Kababek, which is the director of one of the laboratories, said it's like Russian roulette. You never know what's in there. And today we're really worried about things being contaminated with fentanyl, right? High doses of opiates. Fentanyl is a very potent and efficacious opiate that we know is powerful enough to stop respiration, and hence fentanyl overdoses and, of course, deaths due to fentanyl are due to the fact that they stop your voluntary breathing components of the body. And there's no doubt that there are some samples that have been showing up with fentanyl in them. And that's what they're reading here at the bottom of this is suggesting that many of these things can unfortunately show up with fentanyl. So it's very important to make sure that you're getting products that are legit sellers, that have an actual license to be able to sell to get this, because you don't want to be someone who gets a gummy from a friend that says, yeah, it's good, and it happens to have fentanyl in there. Does it affect memory? Again, this is probably one of the biggest questions, so I just wanted to put a nice slide out there. This did come from the National Institutes of Drug Abuse, suggesting the fact that, and this is looking at a rat brain, but we see very similar things in human brain, in which there are high levels of the cannabinoid receptors in areas like the hippocampus, which is important in learning and memory. It's high levels in the cerebellum, important for motor activity, coordination, and even learning motor stuff. And it's a study that suggested that chronic THC really can hasten the age-related loss of the hippocampal neurons. Now, again, you can go on to the NIDA website and read about this study, but what I found interesting about it is that when there's exposure to THC every day, which I know many people will use THC or a cannabis product daily, and in this case, it was a study to sort of replicate the daily use of it for 8 months, showed there was a 30% change in lifespan. Now, again, that may or may not be directly related to the THC and the CB1 receptors. It may be related to the idea of many other things that might be happening. But the take-home message is that chronic use of things like THC may actually cause a loss of neurons that may actually reflect how long a person can even live. Again, this is one of the first studies that was published on the National Institutes of Drug Abuse paper. It's a good one to sort of look at. It says, just make people aware that this could happen. And it could be very similar if you were saying somebody who is drinking alcohol every single day for 8 months. We know that there is a decrease in life expectancy or lifespan there as well. The medical harm of cannabis, again, exposure to cannabinoids can lead to persistent cognitive and psychiatric disorders. Again, a lot of this we're finding out is dependent upon the amount of THC concentrations that are in the products. Many of this can be diminished by lowering the THC percentage or combining it with things like CBD or other products. And so again, I think the idea that research is heading towards is that there may be some really beneficial components of cannabis, as I mentioned, decreasing pain, inflammation, nausea. And I didn't spend a lot of time on all the other things that are being explored for the medicinal purposes. But when I say that, it's with the caveat that we're not using super high levels of THC. We're using very low, if anything, no THC, and trying to use other components to see what their medicinal advantage would be, as well as activate that endogenous cannabinoid system that doesn't seem to produce some of those same effects that high levels of THC do. I have to finish with this last slide because this slide I think is an important one to point out the fact that THC is metabolized by a family of enzymes, what we call the cytochrome P450s. People call them the CYP proteins, CYP. This is a makeup or a chart of the cytochrome P450s that we all have, or at least hopefully have, within our bodies, mainly in the liver, but other parts of the body as well. And it just is an example in the fact that these enzymes are what metabolize THC, but they also metabolize the things that we eat, as well as other medications. And so the take-home message here on this particular slide is that using THC means that you may be really affecting the levels of many other medications. So this is just a short list. You can go online and see if your medication happens to be on here, but it's looking at statins, you're looking at drugs for your heart, whether it's a calcium channel antagonist, whether you're looking at anti-anxiety medications, some of the different opiates. I mean, the point is, when you're taking THC and any of these other medications, you may be actually affecting the levels of these medications in your body. And so you might be thinking, how come I feel strange, or what's going on? Well, by using THC, THC has to use some of these enzymes. The drugs have to use it. Things are all getting bottlenecked and they're not getting through your body and being metabolized and removed. And so that bottleneck may cause all kinds of other problems that are due to other medications. Again, these are looking at prescribed, but there's even non-prescribed medications, over-the-counter medications that may also be influenced by THC. So they can increase levels of medications, they can affect levels of other drugs that may be used, whether it's alcohol or other types of drugs being used. Smoking marijuana can increase the clearance of some other ones, so it may actually enhance the loss of some of your drugs, and that's why they're not working. It can produce additive effects when you have THC on board with other depressants, like sympathomimetics or anticholinergics. And there are all kinds of potential red flag interactions. And so I just want everybody to be aware that if you're going to be a person who wants to use medicinal marijuana or THC products, any kind of cannabis product, again, it's something that I would talk with my physician about. Don't shy away from it. Don't be trying to not say it, because your physician should be aware that you're using that and may have to adjust the dose of your diabetic medication or your cholesterol medication or something else. And so it's important that your physician know this. And so in summary, there's still a lot of unknowns about cannabis and cannabinoids, which of course I like to learn more and more about it and try to do as much as I can, both research-wise as well as investigation-wise, to see if we can learn more about, but there's a lot of unknowns. Most of the studies have been only on THC, but we're just learning so much more about all the other products, those other 499 plus compounds that are in a plant. We're just learning a lot about the endogenous cannabinoid system and how it may be related to helping, as well as its adjusted levels may be even lower in some individuals that have things like, let's say, migraine. So we're just beginning to understand what is the endogenous cannabinoid system. There's great potential for new medications, as I said, to maybe adjust the endogenous cannabinoid system or to produce mixtures of cannabis products that may decrease the unwanted effects of THC. There's also great potential for unwanted and dangerous effects that still need to be further researched, because again, I want to be responsible in the idea that we want to suggest that there may be good uses of cannabis, but that it may also produce some severe harm. So in conclusion, I really feel like there's a great need for more understanding of cannabis, how it affects the body, the medicinal versus the harm, and the fact that we really don't know a lot about it. I am going to be optimistic to think that there's more research that will be done so that we can learn more and more about cannabis. And with that, I just want to thank you for listening to this particular talk.